Dermatitis is the general name for skin inflammation. The condition is often linked to symptoms such as itchy skin and rashes. Many individuals often suffer from dermatitis, and it comes in various forms. The condition includes eczema, which can cause very itchy, red rash. The rash often causes little bumps to form on a person's skin, and in time these bumps can ooze until unsightly crusts form above them. Various factors can cause dermatitis. Here are some of the common types of the skin condition. Atopic dermatitis is commonly called eczema. It's often inherited. The eczema develops during infancy, and a person with eczema may have rough patches of dry and itchy skin. Contact dermatitis occurs when a substance touches your skin and causes an allergic reaction or an irritation. This kind of dermatitis may cause rashes that blister, burn, itch, or sting. Dyshydratic dermatitis happens when a person's skin can't protect itself. It mainly occurs on someone's hands and feet, and it causes itchy and dry skin that usually has small blisters. Seborrheic dermatitis is called cradle cap, and it develops in infants and often forms on the scalp. This condition may cause dandruff, red skin, and scaly patches. The symptoms can occur in other areas of the skin, such as the chest or the face. Neurodermatitis is linked to an itchy patch, which is usually triggered by stress or something that irritates a person's skin. Nummular dermatitis can also cause oval sores to form on the skin. It usually occurs when a person suffers an injury to the skin. Stasis dermatitis is linked to skin changes caused by poor blood circulation. In an article published in the Journal of Alternative and Complementary Medicine, researchers from the University of California, Davis, and the University of Arizona conducted a systematic search to evaluate the role of oral micronutrients in the development of atopic dermatitis. They reviewed 49 different studies and discussed how various micronutrients such as vitamin C, E, D, and trace minerals like zinc, copper, selenium, strontium are linked to the atopic dermatitis. They also highlighted how supplementation can affect the severity of the atopic dermatitis. Ascorbic acid is well known for its antioxidant properties, and this allows it to reduce oxidative damage to the cells. Studies reveal that urine and serum markers of oxidative stress are higher in children who have atopic dermatitis than in those without. Increasing the plasma vitamin C levels can help with the atopic dermatitis management, as it improves ceramide production in the epidermis. Ceramides are the major building blocks of the skin's lipid barrier, which is crucial for the organ's barrier function. The best form of vitamin C would be liposomal vitamin C, which you can learn to make cheaply and easily at home in an ultrasonic cleaner. The next best form would be a non-acidic pH-buffered vitamin C, with the worst kind being cheap, acidic ascorbic acid due to its ability to cause stomach upset. Tocopherol is a fat-soluble vitamin with antioxidant and anti-inflammatory properties. According to clinical trials, vitamin E supplements improve skin itching and the healing of lesions. Although vitamin E deficiency does not contribute to the development of atopic dermatitis, comparisons between the vitamin E intake of people with and without atopic dermatitis suggest that it has a protective effect. For the best quality vitamin E supplement, be sure to get a mixed tocopherol blend. Another fat-soluble vitamin, vitamin D, is needed for proper immune function, specifically immune reactivity and skin barrier integrity. According to several studies, vitamin D deficiency increases not just the risk of atopic dermatitis, but also the severity of the atopic dermatitis symptoms. Vitamin D supplementation, on the other hand, reduces the severity of atopic dermatitis in both children and adults. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Zinc and copper are trace minerals, and they're involved in cell growth and function. Human studies show that while hair and serum copper levels are positively correlated with atopic dermatitis risk, zinc levels are the opposite. Zinc supplementation also only improves the severity of atopic dermatitis in adults. Because high doses of zinc may interfere with copper absorption in the intestine, researchers recommend supplementing with both copper and zinc. Skin cells require sufficient amounts of selenium to ensure that they can fight the oxidative stress, which is a major cause of inflammation. Meanwhile, strontium is said to inhibit skin irritation when applied topically. According to a cohort study, selenium deficiency in infants and their mothers increases the risk of atopic dermatitis, while a strontium deficiency in infants also has a similar effect. Maternal strontium deficiency decreases the atopic dermatitis risk in infants. Researchers from Yonsei University in South Korea suggest that bathing in spring water is a safe way to treat the symptoms of atopic dermatitis. Health experts at the University of Colorado Anschutz Medical Campus examined current literature on the effects of cannabinoids on skin diseases, and they confirmed that pharmaceutical products containing the compounds may prove to be effective in treating eczema, psoriasis, and both atopic and contact dermatitis. According to the senior author, the compound's most promising effect is addressing the severe itch. The senior author cited one study where 8 out of 21 patients who used a CBD cream twice a day for 3 weeks were able to completely cure the severe itching or the pruritus. You could see my other video on CBD and blood flow in the brain for more information about its benefits and dose. Fish oil supplements can help to suppress flare-ups of dermatitis that allergies trigger, as well as provide other nutritional benefits. The omega-3 fatty acids can help to boost the overall immune and the cardiovascular health. Doses can range from 3 to 9 grams per day of a molecularly distilled omega-3 EPA DHA fish oil blend. Hairless mice were fed a diet with reduced magnesium and zinc levels, and they were compared with mice who were fed a standard diet. Skin dryness and wrinkle-like changes, scratching behavior, decreased skin water content, increased transepidermal water loss, and raised blood immunoglobulin E levels were seen in the group who were receiving the reduced magnesium and zinc diet when compared to the control mice. Take magnesium in the form of magnesium bisglycinate. Start by slowly increasing your dose until the side effects like stomach discomfort or diarrhea are noticed. Then gradually reduce your dose until you're taking the maximum tolerable daily amount that doesn't cause any side effects. As magnesium is required by over 300 enzyme systems in the body, it can have profound benefits to health after a few months of supplementation. Collagen use has also expanded into the treatment of some dermatological conditions like atopic and allergic contact dermatitis. A review included one 12-week study that compared the effects of collagen supplementation in 13 patients with atopic dermatitis who were using 3.9 grams per day. The patients that supplemented with the collagen demonstrated a significant decrease in immune response and inflammation. After 12 weeks, skin eruption areas, disease severity, skin hydration, and itchiness were all significantly improved with the collagen supplementation. Oxidative stress has been implicated in atopic dermatitis for more than 15 years, mainly in the following 3 aspects: the presence of the oxidative stress, the increased oxidative stress during the atopic dermatitis exacerbation, and the decreased antioxidant capacity. Powerful antioxidants like coenzyme Q10 in the form of ubiquinol, taken at doses of 200 to 400 milligrams per day, may be helpful. Also astaxanthin at 12 milligrams per day, as well as the previously mentioned vitamin C and vitamin E. Half a teaspoon of turmeric daily can help to cure seborrheic dermatitis, the scaly scalp condition that can lead to temporary or permanent types of hair loss. Some home remedies. You should avoid exposure to certain plants. The dermatitis can be triggered by some irritating plants, so if you need to go outside, wear protective clothing such as long-sleeved shirts, long pants, and boots. Care properly for sensitive skin. If your skin is generally sensitive, prevent more rashes from occurring by taking necessary precautions like washing new clothes and bed sheets or pillowcases before you use them. When buying clothing, opt for natural fabrics like cotton instead of synthetics or wool. These can irritate your skin. Use gentle soap and always moisturize your skin. Applying a cold compress to the skin area that's affected by dermatitis can help to soothe the itching and the burning sensation. Instead of water, you can also soak a rag in cold whole milk. The proteins in the milk can help to reduce the itching and dry out the rash. Don't scratch your skin. It can be hard to resist the urge, but don't scratch. Doing this will only irritate it. Your hands and your fingernails can harbour lots of germs, and these can cause infections if you keep scratching. Identify and eliminate irritants. If you believe that your dermatitis is due to an allergic reaction, you can prevent the skin condition by identifying the irritant and then getting rid of it. Think of any recent changes that you've made, such as wearing new clothing or using different skincare products. In most cases, people are allergic to metals like gold, silver, or nickel. If you're wearing new jewellery or accessories made of these metals, stop wearing them and check if the rash goes away. Some foods that can trigger dermatitis are peanuts, milk, soy, wheat, fish, and eggs. An anti-eczema diet is similar to an anti-inflammatory diet. Examples of anti-inflammatory foods include fish, a natural source of omega-3 fatty acids that can fight the inflammation in the body. Examples of fish high in omega-3 include salmon, tuna, mackerel, sardine, and herrings. For more information about an anti-inflammatory diet, check out my video on inflammation and on antioxidants and on autoimmune conditions. For any information about the herbs or supplements discussed in this presentation, check out my website.